Spice102.1 FM ਤੇ ਤੁਸੀਂ ਸ਼ਾਮਿਲ ਹੋ ਦੀਪਸ਼ਿਖਾ ਬਰਾੜ ਦੇ ਨਾਲ ਤੇ ਹਰ ਸ਼ੁੱਕਰਵਾਰ ਦੀ ਤਰ੍ਹਾਂ ਤੁਹਾਡਾ ਤੇ ਮੇਰਾ ਸਾਥ ਰਹੇਗਾ 7 ਵਜੇ ਤੋਂ ਲੈ ਕੇ 8 ਵਜੇ ਤੱਕ ਹਾਰਟ ਟਾਕ ਵਿੱਚ। ਦੋਸਤੋ, ਜਿਵੇਂ ਤੁਸੀਂ ਜਾਣਦੇ ਹੋ ਕਿ ਹਰ ਹਫਤੇ ਕਿਸੇ ਖਾਸ ਮੁੱਦੇ ਦੇ ਉੱਪਰ ਅਸੀਂ ਡਿਸਕਸ਼ਨ ਕਰਦੇ ਹਾਂ, ਟਾਕ ਸ਼ੋਜ਼ ਦੇ ਉੱਪਰ ਗੱਲਬਾਤ ਹੁੰਦੀ ਹੈ। ਅੱਜ ਦਾ ਇਹ ਜੋ ਵਿਸ਼ਾ ਹੈ ਉਹ ਹੈ ਕਿਊ ਜੰਪਿੰਗ ਦੇ ਉੱਪਰ। ਐਕਸ ਸੁਪਰ ਬੋਰਡ CEO ਡਾਕਟਰ ਸਟੀਫਨ ਡਕਟ ਨੇ ਟੋਰੀਜ਼ ਦੇ ਉੱਪਰ ਇਲਜ਼ਾਮ ਲਗਾਇਆ ਹੈ ਕਿ ਉੱਥੇ ਅਸਲ ਰਸੂਖ ਵਾਲੇ ਜਿਹੜੇ ਪ੍ਰੋਫੈਂਸ਼ੀਅਲ ਲੋਕ ਹੁੰਦੇ ਨੇ ਉਹਨਾਂ ਨੂੰ ਕਿਸੇ ਤਰੀਕੇ ਦੀ ਕਿਊ ਜੰਪਿੰਗ ਕਰਵਾਈ ਜਾਂਦੀ ਹੈ, ਉਹਨਾਂ ਨੂੰ ਪ੍ਰੋਫੈਂਸ਼ੀਅਲ ਸਰਵਿਸਿਜ਼ ਦਿੱਤੀਆਂ ਜਾਂਦੀਆਂ ਨੇ। ਇਸ ਚੀਜ਼ ਦਾ ਇਸ ਸਮੇਂ ਅਲਬਰਟਾ ਦੀਆਂ ਚਾਰੇ ਆਪੋਜੀਸ਼ਨ ਪਾਰਟੀਜ਼ ਤੇ ਈਵਨ ਟੋਰੀਜ਼ ਦੇ ਵਿੱਚ ਜਿਹੜੇ ਹੁਣ ਲੀਡਰਸ਼ਿਪ ਦੇ ਲਈ ਕੰਟੈਂਡਰ ਨੇ, ਉਹਨਾਂ ਦੇ ਵਿੱਚ ਵੀ ਇਸ ਗੱਲ ਲਈ ਇੱਕ ਇਸ਼ੂ ਕ੍ਰੀਏਟ ਹੋਇਆ ਹੈ। ਅੱਜ ਦੀ ਇਹ ਇੰਟਰਵਿਊ ਇੰਗਲਿਸ਼ ਵਿੱਚ ਰਹੇਗੀ ਕਿਉਂਕਿ ਮੇਰੇ ਸਾਰੇ ਹੀ ਗੈਸਟ ਉਹ ਇੰਗਲਿਸ਼ ਸਪੀਕਿੰਗ ਨੇ, ਪਰ ਮੈਂ ਤੁਹਾਨੂੰ ਪ੍ਰੋਗਰਾਮ ਤੋਂ ਬਾਅਦ ਜੋ ਗੱਲਾਂ ਹੋਈਆਂ ਉਹਨਾਂ ਦਾ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਟਰਾਂਸਲੇਸ਼ਨ ਕਰਕੇ ਜ਼ਰੂਰ ਦੱਸਾਂਗੀ। Since October, when Dr.Raj Sherman, along with other emergency doctors, warned Stelmach government for EI weight catastrophe, then Dr. Sherman was kicked off from caucus, then Dr. Stephen Duckett cookie event. Then scapegoat became Duckett was fired from Superboard CEO, and now ex-Superboard CEO Stephen Duckett's allegations of queue jumping or preferential health services for so-called prominent people of Alberta. That may be how, along with me, you, all the Albertans have been feeling lately, as every month seems to bring fresh clues that our premium health care system seem gradually to be falling apart. On weight line adjustments for MLAs and other influential people, all four opposition parties and even progressive conservative leadership contender, a recent cabinet minister, seized on Mr. Duckett's remarks to further pressure on Premier at Stelmach to commission a public or judiciary inquiry. But we have also learned from Health Ministry today that document leaks does not prove queue jumping. Today in Hard Talk to discuss that matter, I should say hot burning issue, we have invited Dr.Raj Sherman, NDP leader Brian Mason and Wildrose party leader Danielle Smith. And I called at Honorable Jean Zwiderski's office, but he had some prior commitments and he was unable to join us today. So first of all, we have Wildrose Alliance leader Danielle Smith. Hi Danielle, welcome in Hard Talk.
Hello Deepshikha, thanks so much for having me.
Danielle, first of all, tell me that is it really a big thing? Is it really an issue?
Queue jumping is a really big deal to Albertans. I think Albertans believe that, and I think they're rightly to believe this, that when we have a system where we're rationing care, where people are waiting years for treatment in some cases, where they're waiting months or years to see a specialist, people are prepared to live with that result as long as they know that their turn is coming up and as long as they know that they're being treated fairly. When you have allegations of queue jumping, that politicians are able to use their influence to get faster treatment for themselves or their family or their friends, it throws into question the integrity of the system. I think Albertans are outraged, Albertans are upset, and they really want to get to the bottom of it, which is why we continue to call for a public inquiry, along with the other opposition leaders and even a few PC leadership candidates. Yeah. I think Albertans need to see some of the answers so that we can start addressing these issues and ultimately solve them.
And leader, now Honorable Jean Zwiderski said today that document leaks won't prove anything. What would you say on that?
Well, I think the document that Mr. Brian Mason leaked yesterday shows that the Tory caucus knows that this is a problem, that it's a problem that's been in the system for some time. Clearly, Dr. Stephen Duckett's memo from a couple of years ago telling people that this influence use is not permitted anymore, and if there were any surreptitious requests to try to alter the waiting list, that they should be directed to him. I think it's fairly clear that this is a practice that has been happening in Alberta. It doesn't do anybody any good now to try to deny it's going on. I think the government would be far better off to acknowledge that it's happening apologize to Albertans for the fact that it's happening, and then commit to eliminating the queues. This is really the only way that you will ultimately eliminate queue jumping and political influence, is that we have to get our waiting list down to a medically reasonable period of time, as they have in many other countries in the world. And that's the way that you can ensure that all Albertans get the health care they want and need when they want and need it.
And another view of this allegation, if preferential services were given to prominent people, then why Ralph Klein had to wait for approximately 2 years for his dementia?
Well, that's, it's such a good question. I mean, I gather that it isn't in all cases that people who are in positions of influence are using that position of influence to be able to get faster care. It sounds like it may be a little bit more subtle than that, but I guess the question does arise for everyday Albertans, for people who don't have that level of access, is they have to wonder if for themselves and their loved ones, when they're waiting for care, whether or not the reason for the waits and the reason for the bumps in the surgical times is because somebody else is able to use their influence to get faster access. And when you have that kind of distrust of the system, you really do need to have a public inquiry so that we can bring nurses and doctors forward, talk about the things that are going wrong, and then start doing the diagnosis of what you need to do to be able to change the system to improve performance and access. I hear everywhere that I go around the province that people are very frustrated at the wait list. They're frustrated at the lack of access. They're frustrated that the more we pay, the worse the service gets. I think Albertans aren't going to put up with it anymore, and the first step to solving it is to have a public inquiry so we can get to the bottom of the allegations.
And Daniel, last but not the least, Alberta Health Services spend more per head compared to other provinces. And today, this afternoon, $12 billion budget is released for better health services. Will it be another spending practice, or province will really get the benefit out of it?
You've absolutely put your finger exactly on the problem, and this is the thing. I would urge everyone, if they could, to go online and to watch Stephen Duckett's full speech. I mean, The allegations of queue jumping are only part of it. The full speech, and I believe it's at lockwood.com. I'm sorry if I don't remember the exact website address, but the full speech is quite shocking because he starts off by talking about how bad the system has become since 1996, and the fact that the more money we spend, the worse results we get. Back in the early 1990s, Alberta enjoyed some of the highest health outcomes, the longest life expectancy, the shortest waits for cancer treatment, and after 10 years of overspending, spending well in excess of other provinces, not only do we have lower life expectancies, we also have longer waits for critical surgeries and critical care like cancer. That's a problem with a broken system. Money isn't going to solve this. We need to look at new ways to deliver health care if we're going to get better results.
Thank you, Daniel. Thank you for your time, and best of luck for your success.
Talk to you again.
Bye-bye.